Good afternoon and welcome to DRH Facebook Live. I'm Cindy Crook, Director of Marketing at Duncan Regional Hospital. And today, as a celebration of Heart Month, we're with James Purcell, who's the Manager of Cardiology here at Duncan Regional Hospital. And he's going to talk to you about heart health and about what we call our cath lab and all the procedures that we do here. So, James, thanks.
Thanks, Cindy. Hello, how are you all today? Thanks for letting me come in and join you and have this conversation here. What I wanted to start talking about today was just a little bit about heart disease. Obviously, February is Heart Month, and heart disease is prevalent in the United States. It's about 650,000 people die annually from heart disease. So obviously, it's the #1 leading cause of death in the United States. Some leading risk factors for high blood pressure, elevated cholesterol, smoking, diabetes, are all things that increase your risk for heart disease. Surprisingly, men have about 50% of the men die of sudden cardiac death, which means that basically sudden cardiac death and they die. In women, it is the #1 killer in women, but about 54% of women don't know that it's the #1 killer of women. Which is interesting. You hear about all these other disease processes, but heart disease is a pretty big killer for them. So things to look for, so like signs and symptoms, always say anginal pain or chest pain, jaw pain, radiating down your arms, nausea, vomiting, breaking out kind of cool, clammy sweats, all signs that you might have something going on, could be going on. Those are all things that if you have those types of symptoms, you want to go, go to the emergency room and be evaluated. Also, if you have these symptoms on and off, you can visit with your physician about it and be evaluated. There's lots of different testing that we can do. We do stress testing. We actually, this month, we do the heart scan is this month. That's for February, obviously Heart Month. You can do heart scan. Looks for calcium buildup in your heart. And it's this month, it's special since it's Heart Month. It's, let's see, 2 for 100. So come in with you and your significant other, come in and get your heart scans done together and see how you're doing. So what I kind of really want to talk about today is not only heart disease, but I want to kind of talk about our cath lab here at Duncan Regional Hospital. If you come in and you've gone through all the testing, or you come in and you have some type of coronary event, the likelihood of you ended up in the cath lab is pretty high. It's one of the best ways to go in. We actually can go in and visually look at your coronary arteries to see if you have any kind of blockage which is causing your pain and discomfort. And so that's what we have here is cath lab. When you come in to see us, there's a lot of things that will go in Intel that will get you ready. Our cath lab is designed where we actually have 7 holding rooms here, and you can be in there. We actually get you set up preoperatively here, and then we'll bring you in here to the cath lab, which is this is where we're filming it. So in case you can see, it is the cath lab. Here's the cath lab table right behind me. And we'll bring you in here. We'll do your procedure. There's typically the approach that we use here is we like to do a radial approach. So we'll gain access into your artery through your arm. If not, they also can use your bones too. But we like the radial is a little bit nicer after your procedure. You get to sit up. You don't have to lay flat, or if you go up your groin, you have to lay flat for quite a while, or we can sit you up and we do your radial. So it's not too bad. But we'll bring you in here. You'll have a team in here. There's typically 3 or 4 team members in here that will be taking care of you. And then you'll have of course, your physician will be in here doing the procedure. They'll basically get access and feed, put a sheath into your artery, which basically gives us a port to be able to get access to, where we can run wires and tubes up to your heart, where we're going to squirt some dye into your coronary arteries and look and see if there's any blockage. And if you can look kind of behind me, just watch that. I'll step this away a little bit. You can see kind of the monitors that we'll look at when we squirt that dye in there. It's live pictures. We'll watch the blood flow through your coronary arteries and see what it looks like. See if there's any narrowing. If there's any narrowing, then we can go in and we can fix it. Feed some more wires in. Go in and do what they call angioplasty, which is put a balloon up or put a stent in. Some of the procedures that we do there. And then once we're done with that, we'll get you off. We'll take you back and let you come hang out in our recovery area, same place that you started in the pre-op area, and you'll stay with us for about 4 to 6 hours afterwards, and move on from there. If there's something that needs to be intervened on, depending on what you have going on, how sometimes you have to be admitted to the hospital. You'll go upstairs, stay overnight, and be discharged the next day. So anyone else going to talk about that?
Why don't you tell us about our new cardiologist that's here, Dr. Ekpe?
Yes, so Dr. Ekpe has joined us. She joined us in November of 2018. She's a general cardiologist. She will utilize us and has referring, we'll see you as a patient in the clinic. She'll see you in the hospital. She has the ability to refer you to our interventional cardiologist, which is who will bring you into the lab here. Dr. Ekpe won't do any procedures here in her lab. She does other procedures for us. She's great. You can get in touch with her office, and they can get you scheduled to get in and see her in an appointment. She's obviously got lots of openings, so if anybody wants to go see her, please give her a call.
So let's go back to when you were talking about heart health. You were talking about the different signs of a heart attack. What's the difference between the signs that a man would have versus a woman? I've always kind of heard a woman's signs might be just a little bit different.
So they do. A lot of times women sometimes won't even present with any kind of signs. They don't have any pain. And that's that kind of, when you hear that word silent heart attack, and so you don't have any pain. Men can experience too, but you see that in women. But it's the big thing is you have the jaw pain, bilateral arm pain going down, chest pain, crushing, something sitting on your chest, elephant sitting on your chest, is how they would describe it. Squeezing is kind of the sign symptoms you kind of look for heart attack.
So then you also talked about one of the tests that you do is a stress test. And so when I think of a stress test, I think you're putting me up on a treadmill and making me run. Is there other ways of doing a stress test besides that?
Yes, so one is an exercise stress test. The other one would be a chemical stress test where we put some dye in, use chemical to stress you. They'll take pictures of your heart while that's going on and look to see if there's any areas where there's ischemia, which is where you have decreased oxygenation of your tissue, to identify if there's any areas that we can potentially reverse and stop.
Okay. So we do have a question from a viewer. They want to know, what is the heart scan? And you might also mention, you did mention the special, but the price of what it is.
Oh, so the heart scan, it's a CAT scan. So it's the imaging that's done in our imaging center by CAT scan. They put you on a table. We'll put you in there, take pictures of your heart, and what it's looking for is calcium buildup in your coronary arteries. And so we're able to see that calcium buildup, and they will score it based on how much calcium is seen, and they will give you a calcium score. And that's the important thing that you want to go. The lower the calcium score, the better. The higher, it's more problematic. You want to be looked at. And so
This month they're 2 for $100.
2 for $100 for the heart scans this month. So if you just get a partner, come on in. It doesn't. Family, friends, moms, dads, come on in. Get your 2 for 1s this month. It makes it nice.
So now going back to how things are done here in the cath lab. So would a person, are they asleep when you're doing a procedure?
So yes. They're not completely asleep. We do what we call moderate sedation. So we give you some medicine at the direction of our physician, which will allow you to be comfortable on the table. There's pain medicine that they give you so that you're not hurting. For the most part, the procedure itself is not painful. Probably the most painful part of the procedure is actually the access. When we're giving access, they do a little bit of numbing medicine at the local injection site to prevent that. But we do give you some medicine, some pain medicine, and some forgetful medicine, so you're just relaxed on the table. But we talk to you sometimes, and some people will sleep through it. Some people will just sleep through it. But some people will talk to you, and if there's things going on, we'll talk to the patient. most people communicate with us.
So we have another question from Patricia. She wants to know, what does the term STEMI mean?
So STEMI is what they call an ST elevation MI. So ST elevation myocardial infarction. That is when you come into the hospital and we put you on an EKG machine, which is our ability to look at your heart rhythm. So let's measure the electrical activity of your heart. You will see, when we look at it, there's elevation in that, the ST segment of that EKG, you will see elevation, and that indicates that there is decreased blood flow going to that area, and so it starts to elevate. It takes longer for that electrical activity to travel through, which causes it to start elevating, and that's what we call STEMI. And that's, when you hear the term heart attack, that's STEMI and heart attack are one and the same. You'll hear, that's the big heart attack, it's a STEMI.
Another question is, you mentioned that you put contrast in,
Yes.
so you can see the coronary arteries, is that correct?
Correct.
Will I feel that going in?
No, you usually don't. When you do, you don't really feel that. We use a different kind of contrast. We typically don't feel that being injected into your coronaries. Now, there is part of the procedure that we do that we sometimes will do is called a left ventriculogram. And that is actually where we will actually, in this particular one, you might actually feel. This is where we will put a catheter into your left ventricle, and we will inject the dye in a large bolus, which is just a large amount of it. And sometimes you get hot, warm, and flushed feeling all over, and that's the times that you feel that contrast. Other than that, when we're doing a heart look at coronary arteries, you typically don't feel the contrast.
And you may have said this and I might have missed it, about how long does a procedure, I know there's different variables, last?
Oh, probably 30 minutes is a good estimate about how long a general procedure lasts. Depends on what we get in there, what we find, what we need to do, but about 30 minutes.
Okay. Can you list exactly what procedures we do perform here?
Okay, so we do coronary arteriograms, ventriculograms, so left heart catheterization is what that would be. We also do what we call, peripheral angiograms. So same thing that we're doing looking at the heart, we'll also look at your legs. We can squirt dye down your legs and look at vessels in your legs. We do interventions, so we can do stenting and do a balloon angioplasty if needed here. Those are probably the big procedures that we would do. Though there's other things that go along with that, but those are probably the big procedures that we do here, actually in the lab.
I noticed there's a room back there and there's all kinds of monitors and stuff. So when a procedure is going on, is there staff also back there monitoring what's going on, or is the staff all in here?
No, there's staff. There's someone usually always sitting at that monitor there. They're monitoring the case, watching your heart rate, watching your rhythms, making sure everything's going on. They're controlling some of the X-ray machine from that ability. If we, for some reason, we want to stop pictures and want to reevaluate some pictures that we already took, they'll control that from in there. We can also control them out there, but they'll stay in there and do that. And so that's usually in that room.
And then, and then you said after a procedure, you go into the recovery room, basically the room that you started out in. How long am I in there?
Depends on which route or approach we took. So whether we went through your wrist or through your groin, but you're looking at about 4 to 6 hours is kind of the standard recovery time, and that'll vary a little bit. Again, it's based on approach that we take.
And I'm not sure if you could answer this, but why would you go through the groin versus the wrist, or the wrist versus the groin? So
physician decision. Sometimes there is like the approaches where we're trying to get access. Their radial approach, which is the wrist, is a newer technique. And trying to get up to the heart when you're trying to bring the catheter all the way up and around can sometimes be challenging. People have different anatomies. Your vessels can start to curl and do some things where you can't get it fed up, the catheter fed up to the heart. Sometimes you have to go bigger. So we have a patient who is not doing very well. We need to get a much larger catheter and our larger sheath in to be able to do what we need to do. Then you'll probably switch to the growing approach because it's a much larger vessel you're going into. Would be one of probably the bigger thing that we would change to going down there. And then again, if you don't have, some people don't have as good a flow in their arms as we would like, and those the doctors will kind of preoperatively make that decision and maybe make the decision, there's not a good enough flow here, I don't think this is going to work well, I'm going to go ahead and start with the growing approach.
You said that you do some tests. Is stress test the only kind of test? Is there any tests that are specifically need to be done before I have a procedure? Blood tests or anything?
So we do stress test. We do blood tests because we obviously, the contrast, the dye that we're going to give you, we want to make sure that your kidneys are functioning properly so that when you filter that contrast out, that it does well with that. So we'll check your blood work. I think any other preoperative testing that we'll do. Obviously, before you get here, obviously you have the stress test, you have EKG. Some people will have an echocardiogram before they come in to see. One of those is looking for the ejection fraction, which is the squeezing of the left ventricle and how much blood flow is squeezing out. See how well your heart's working. So you have that too.
Okay. I know right now it's kind of hard to see on our screen, and it's hard for us to move. But there's if you look to James's right, your left, as you're looking at him, does that thing move over and kind of go around?
Yes. So this is a C-arm, and it will move over the patient. We'll slide the table in, and we'll also slide that in. This whole thing will rotate completely around the patient depending on what angle and what pictures we need to look at. So when you're in here and we're shooting images, we'll typically shoot 4 or 5 different angles of pictures of your coronary arteries to look to see if there's, based on the angle, is there something else that I maybe have not seen from one angle and another angle I can see there's something. So that's why we take so many pictures. But yes, this will circle all around. You're basically parallel and perpendicular is about where we'll go. But anyway, and then it slides in and out. It does have the capability that if we need to. Obviously, the table there's a short space here between the table. This whole arm will pivot around, and then we can slide the table further. So, like, particularly when we're looking at your legs, we can get down there and actually see your legs. So that's why that does that.
And so do the images that you're taking there show up directly on those screens behind you?
Yes. So they'll show up on these screens here. You can see this for typically the one up top is the one we're looking at. The one on bottom, if we were going in to do a procedure and we found some blockage that we wanted to look at and try to fix, we would take that picture and take a freeze frame and put it there on the bottom screen so that the physician, when they're trying to get their wires and balloons in place, they have a kind of a roadmap that they can see where they're going, and they'll be able to compare it with the live image versus the still image so they get into the right location when they want to be in.
And so you're an RN. Who are the other, besides the physician, who are the other staff that are in here when a procedure is being done?
So typically we have one RN in the room, and then we have, there is a scrub tech who will be assisting the physician, scrubbed in with the physician, and then we have an x-ray tech who does our monitoring, and they're the ones that are typically in the monitoring room. And we all kind of transition roles, so we all kind of know a little bit of each other's roles too, so we kind of intermingle amongst that. But there's typically 3. Occasionally we get a 4th person in here, but usually we have 3. We run a 3-person team.
So the cath lab's been open how many years now?
4 years.
4 years.
4 years.
I know you may not have this number right on top of your head, but can you give an estimate of how many procedures you think we've done?
We have done, I want to say about 450 cases we've done. Coronary, if you want to talk about coronary cases, which is the heart, about 450 in the last 4 years.
Great. So really I've asked all my questions. So is there anything else that you think that people need to know about the services we offer here at Duncan Regional Hospital? Is this in your area for heart?
Well, so some of the other things that we do in the area, so we talked more about the cath lab itself. The cath lab team also takes care of other patients that never make it into the cath lab. They will stay out there in the pre-op and holding areas, as we describe it. But we also do transesophageal echocardiograms. So that's another way for us to go in and take a look at your heart by ultrasound, which entails with them going in it goes in through your esophagus down on the backside of your heart. It allows us to look at some other images. We do cardioversions. So if the patient is in an atrial fibrillation rhythm and they've been there and it's uncomfortable and it's really
Can I
fast.
stop you? What does that mean, that rhythm that you're talking about?
Atrial fibrillation. So atrial fibrillation it's one of the rhythms that your heart can go into, and it's a very common rhythm. But what it happens is you have four chambers of your heart, and you have the atrium on top and you have the ventricles on the bottom. And what happens when you get into atrial fibrillation, the top two atrium, they just kind of quiver. They don't really pump, and so the blood just kind of falls through into the ventricles and you squeeze. So you kind of got this quivering, and you got this nice squeeze of your ventricle. And it's just a different type of rhythm, and it's one of those things that we have to be careful with. People can develop, with that quivering, that blood is sitting and pooling in those atrium there, that you can develop clots. And so one of the things that we do, a good example about atrial fibrillation, we might do a TEE, a transesophageal echocardiogram on you, to look to see if you have any of those blood clots before we move on to the other procedure that we do, which is a cardioversion. Which a cardioversion is where we will do basically electricity. We put some pads on you, we hook you up to a machine that we call a defibrillator, and we will do what we call synchronized cardioversion, and that allows the monitor to detect your heart rate. It hits you right where it wants to hit you with the electricity, and it basically kind of resets your heart to get you out of that atrial fibrillation rhythm and get you back into a normal sinus rhythm.
Okay.
So the kind of two go together. We can do them independently. A lot of times we just do a TEE, and sometimes we will just do a cardioversion. These patients they'll be in that rhythm, and the physician has chosen that I'm just going to put them on blood thinners for a month, let the blood thinners kick in and start working, and then I'm going to do the cardioversion. So we can do that too. So kind of physician driven in how we do that.
And you're also over cardiac rehab.
Yes, ma'am.
Why don't you tell us what would happen in cardiac rehab?
So cardiac rehab is another area that is kind of the post-recovery area of anybody who's had a heart attack. There's other things that you can go up to cardiac rehab for. So if you've had bypass surgery or CABG, if you have heart failure, those are some of the big things that will get you up to cardiac rehab, and it's an exercise program that is monitored by a nurse and an exercise specialist, and they will evaluate you and get you set up on a program for exercise. Typically, it's about 36 sessions is what we can usually get you in. And it's basically getting you recovered from your injury, from your heart attack or whatever would occur, your bypass, so that you can get back out and get back to your normal living and be able to get that strength and energy built back up.
Great. Do you have to have a doctor's referral to do cardiac rehab?
Yes. So doctor's referral, and if the doctor just refers you, we get in here and then we work to get you in order to get you into cardiac rehab.
Back to procedures in the cath lab. What is the, do you do children or is it 18 and older?
18 and older.
18 and older. Adults only.
Correct.
Okay.
Correct.
I think really this is great. I learned a lot about the cath lab and what you guys offer or anything like that. Just a second. Oh, well, we do have a question.
Okay.
What diagnosis do I have to have for cardiac rehab?
Good question. Good question. So you have to have had an MI you have to have had an MI, had a CABG bypass surgery. Those are diagnoses. Angina can get you in, so that chest pain that can get you in, the doctors can get you qualified with that. Congestive heart failure, CHF. I don't think if there's anything else.
Is stroke?
Stroke is, well, not stroke itself won't get you into cardiac rehab, but depending on what caused your stroke, did you also have maybe a heart attack or something else going on with it, potentially could get you into cardiac rehab.
So the key thing is they need to check with their provider
Correct.
to find out if they would qualify.
Correct.
Okay. Well, James, thank you.
Well, thank you.
Appreciate it. And if you have any questions, you can call Duncan Regional Hospital Cardiology Department or talk to your primary care provider. And look for us next month for our next Facebook Live. Thank you.